Hi, my name is Dr. Joshua Chong from Terra Medical Clinic in Singapore, and today we've teamed up with the team from Nourkrin to answer some questions specific about male pattern hair loss. Early signs of male pattern hair loss include a recession of the hairline as well as thinning over the crown. Some people notice that hairs are getting smaller, that's called miniaturization of hairs, and some people also observe some increased shedding. Although being diagnosed with male pattern hair loss can sometimes lead to complete baldness where you lose all your hairs on the top of the head, just leaving the donor areas behind, that's not always the case. Some people will have limited extent of male pattern hair loss, or some people may intervene early enough to stop the progression of male pattern baldness from becoming a very obvious full head of baldness. While there is no cure to male pattern hair loss, we certainly can help to manage it well. Your hair restoration physician would be prescribing you a bunch of medications perhaps to help to suppress the rate of hair loss and help to grow stronger hair. He or she may also be getting you to start with some supplementations such as proteoglycan replacement therapy. What that would do is actually to help the hair cycle normalize so that your hairs can grow in a more timely fashion. The hair restoration practitioner may even suggest that we fill up areas of hair with a surgical procedure known as a hair transplant to rectify areas of baldness.